lesion is the same, but slight X-ray will be different. 2, okay? 2 or 3. For example, question like this. Question number 1. Maybe this is 3 mark. First question will carry 2 mark. Second question will carry 1 mark. So, tell. There is no fracture here.
DK.
Number.
Okay, he said DK. Radiolucency or dental caries in relation to 7. Okay, then radiopaque restoration 6. Alveolar bonus 3 points. General. Now you come to the lesion. You say 0.5 centimeter, periapical, well defined, corticated, radiolucency. Only that much. Clear? Now, see the second question. Give 2 differential diagnoses for the lesion in relation to the first molar. What will be the diagnosis?
Abscess granuloma.
Abscess granuloma, fine. Finish, full mark. Yes? Here, interpret the lesion. If you say interpret the lesion, you have to find out where is the lesion. Where is the lesion? Hard palate. So now interpret this. Yes, site. What is the site? Good, hard palate region. If you don't remember that hard palate landmark, what do you say? In the periapical region of all the maxillary teeth. The bust is near the hard palate. This is the hard palate, right? Hard palate region. Site. Shape. It is cylindrical, like a rod-like shape. Then size. What is the size?
8.
Okay, 8 into 2 centimeter or 6 into 2 centimeter. Clear? Density. Radiopaque. Margin. Well defined. Effect. No effect. It is superimposed. It's no effect. Okay. Yes, there is no. You can see through this opacity. You can see the shadow of the root apex. See, can you see it?
Yes.
So there is no root absorption. So no effect. Extension. Anterior posterior. I think the same thing I discussed in the last class also, right? Yes. So anterior posteriorly start from first molar of one side to the first molar of the opposite side. Superior inferiorly starting from hard palate till the periapex of the molar, maxillary teeth. Clear? Next question. Give 2 DD for this. Osteoma, then
Cementoma.
Cementoma, pages. All
Adult
fine,
term.
no problem. Even this also fine. Clear? But actually, it is not as you said. It is a torrent, maxillary torrent. But if you say osteoma, cementoma, you will not lose mark. But actually, this is a maxillary torrent. You will take tomorrow's class, no problem. This also we discussed again. Interpret the lesion marked by black arrow. Yes.
Size.
Yes. Next point.
Size.
What is the size?
6.
Okay. 6 into 2. Next is shape.
Regular.
Irregular then or rod like then. Radiolucency with some calcification. Multilocular. Margin is well defined. Scallop. Effect is not there. Extension starting from anterior posteriorly from ramus to the midline, superior inferiorly from the alveolar crust till the lower border of mandible. Give 2 differential diagnoses for the same. Ochronogenic keratocyst, anything, right? Interpret the lesion seen on the mandibular body. Can you see any lesion here?
Yes.
Now describe it.
Angle of the mandible.
Body. Yes. Not angle, it is in the body. Yes. Or it is both body and angle of the mandible.
4 centimeters.
Not millimeter, it is centimeter. No? So around 4 into 2 centimeter. Shape is irregular.
Irregular. Well defined.
Multilocular radiolucency or sobable pattern with well defined margin and corticated appearance, right? It's clear? Okay. Next is effect. No effect here because there is no teeth, no expansion also. There is a mild expansion of alveolar here, right? Extension. So starting from mid ramus till the first molar region. Superior inferiorly starting from alveolar till the lower border point. See, the second question is give two differential diagnoses. Glioblastoma, then monogenic keratosis. Fine. Okay. Here, interpret the lesion seen in relation to the first premolar.
Periapical.
Yes.
1 centimeter.
Yes.
Radiopaque.
Round.
Round.
Radiopaque.
Well defined.
Well defined and yes, well defined and surrounded by a reducing line. Effect.
Resorption.
That's it. Nothing else. Give two differential diagnoses.
Hypersyntose.
Then cementoblastoma. Cementoblastoma or hypercementosis. Right? Here, interpret the radiograph. Radiograph means kullu, tooth, lesion, everything. If the interpretation is lesion, you talk only about the lesion. If the question is interpret radiograph means everything, including the lesion.
Huh?
18, 28, 38, 48, all are missing. Oh, sorry, all are impacted. Next question, next point.
Restoration.
Radiopaque restoration in 2, 6, 3, 5. Then there may be mild alveolar bone loss, right? Generalized alveolar bone loss. That's it. Now you can come to the lesion. So now stop. Just try discussing. Periapical of 5, 6, 7. Anybody else has got any other? Yes, yes, pericoronal of 3/8. If you say pericoronal of 3/8, that is correct. If you say periapical of 5, 6, 7, this is also correct. Clear? Yes. So first S is finished. Next S. Shape, irregular, oval. Okay. Then size. Around 3 centimeter, around 4 centimeter, no problem. Then density. Margin.
Well defined.
Well defined, and some areas you can see corticate. Effect is root resorption and
Fraction.
Expansion.
expansion. It's not fracture, it is expansion. So two effects here: resorption and expansion. Clear? Extension. Anterior posteriorly starting from first premolar till the third molar. Superior inferiorly starting from periapical of molar teeth till the lower border of the man.
Doctor, normal alveolar bone. Where?
Where is normal? There is a mild bone loss here on top, right?
Yeah.
Okay, how will you know there is a bone loss or not? The normal distance of alveolar bone from the CEG is 1.5 millimeter. If it is more than 1.5, we call it as a resorption, right? So, okay, so what are the two differential diagnoses? If, dentigerous cyst, then glioblastoma. Okay. If you write periapical cyst also, it is okay because it is seen as the periapics, right? Okay. This is all I told you before. Interpret the radiograph. No need of diagnosing here. Okay, only interpretation of radiograph. Missing 1/6, impacted 2/6 is missing, 2/8 is impacted, 3/6 there is a decay, even 3/7 there is a decay. Generalized alveolar bone loss. Know about the bone. There is ground glass appearance and there is absence of lamina dura. Yes?
Yes.
Yeah, that we said already. So absence of lamina dura and ground glass appearance. Clear? Interpret the lesion. Interradicular,
Round.
radiopaque, around 1 cm, less than 0.5 centimeter or 1 centimeter, well defined, well corticate, well defined and surrounded by a radiolucency, which is again surrounded by a radiopacity. Effect here is displacement of teeth. Extension is not required. Give one differential diagnosis. Odontome complex. Okay. Identify the view. Not occlusive. Waters means patient is drinking water. This position. This is occipital. Here we cannot see
meant to
this.
exhibit.
It is not waters.
Meant to exhibit.
What is it?
Meant to exhibit.
Submental vertex. From here, the film is kept here. This is from here. So this is called submental vertex view or jug handle view. All are same. What do you see here? What is this landmark? Zygomatic arch.
عشان نشوف الزيجوماتيك arch بس.
That's a fracture. Okay. So this view is taken mainly for detecting the zygomatic arch fracture. So this looks like a handle of a jug. You know, jug. That's why the name jug handle view. Also called submental vertex view. Okay. The first question: identify the view, submental vertex or jug handle view. No problem. Mention the pathology. What is the pathology here? Fracture of the zygomatic arch. Clear? I didn't take much about the fracture because same thing is covered in oral surgery, right? Identify the view.
CT.
CT. I mentioned the area.
Condyle.
Condyle. That's it. 2 questions. Half mark each. Clear? This is not taken. Identify the image. Because this is a panorama, but here something else you are seeing. So this is special image. How you know the calligraphy?
It's like liquid.
No, it is taken where? Pathology? Surgery? Ah. What is the title of this surgery? Huh?
Definishing a diagnosis and biopsy.
Of?
And biopsy.
And biopsy. Oral surgery? Okay. So we have one class, salivary gland diseases. This is on the 13th week. There is a lecture on salivary gland diseases. In that we will discuss it. But now I am showing because you said you want exam next week. Okay. So this, you say some dot here, and you can see some structure. This is the duct of the salivary gland. This is inside. So there are some injections, contrast medium. You know what's a contrast? It's inject into the blood. So this contrast medium will be radiopaque. That's why the name contrast medium. We'll give same injection into the gland. Inject it. It will go inside the gland. Okay? With the gland, so with the syringe, go to the room and take a radiograph. Then you remove it, give some chewing gum or some lime juice. Because of stimulation, all the contrast medium will come out of the gland. Then after 5 minutes, you go to the room, one more radiograph. After 5 minutes, it should be totally empty. There should not be anything remaining inside. Right? If something is remaining inside, that means there is no salivary gland pumping action. Some block in the gland. Okay, that is different story. Now here the identification of the image is, this is called silograph. Silo means something to do with salivary gland. Graph means picture. Picture of salivary gland. What you are seeing here is picture of salivary gland. Clear? This is actually a disease of gland called Sjogren syndrome. This is called cherry blossom appearance or fruit laden tree appearance. Okay, so what will you write here? Silograph. Here, identify the image. Only identification. Just identify the image.
تلفزيونية.
Good, very good. Ultrasound. That's it. You have to know whether it is ultrasound, whether it is CT scan, whether it is MRI, whether it is salivary gland. Only that identification you have to know. Clear? Okay, identify the view. Identify the view.
صدمة.
What is the view? First tell me view.
CT.
CT. It is not submental vertex.
Axial CT.
Excellent. This is axial CT. So this section is called cross section is also called axial. If you write cross section, no problem. This is called axial. This section is called as coronal. So this is an axial CT. So the first question is identify the view, CT. Second question, mention the section. It is axial. Clear? Okay. So next week, 13th week, 12 o'clock, one of the lecture class. Okay? There will be 14 slides. Out of this, maybe 3 will be new, but the diseases are the same.